just to give a presentation on how we managed to implement an IVI&A case. This was on the back of the Amber Alert that we received last year. So just to give a quick recap to you, because I'm sure most of you are already aware. So we received an Amber Alert notice. This was on the 12th of October last year, and this was advising us that red stock levels were low, and these levels were they'd reached the threshold at which an Amber Alert had been issued. So NHSBT advised us that they would remove the alert once they were confident that stocks had received had reached a sustainable level, but it was expected that this would last at least 4 weeks. The notice asked that we all implement our emergency blood management arrangements suitable for an Amber Alert shortage, and to consider looking at things like alternatives to transfusion. We were advised in the notice not to proceed with elective surgeries in patients with anemia until it had been properly diagnosed and treated. So, as instructed, we held our first meeting in the trust the same day with our emergency blood patient management group. And it was at this meeting, while we were discussing the impact on patient care, we talked about the possibility of patients receiving IV iron. This was something that we had discussed before within our hospital transfusion team meetings, but it wasn't really a service that we were offering trust-wide. We did have a setup already in haematology, so they used to do IV iron on a day that they were not doing chemotherapy. We already had a setup with maternity as well. But as a surgical point of view and the rest of medicine, it was something that we were trying to look at. But where we were struggling with was just trying to find who was going to take ownership of this service, really. Because obviously we wanted it to be across medicine and surgery. So it was something that had been discussed before, but it wasn't something that we felt that we were already one step ahead with. So during this discussion of this meeting, we did actually learn that IV iron was being offered on our gastro ward to one gastro patient per day. So it was agreed that we would look at our capacity for expanding this service across surgery and medicine. So from here, with the help of our gastroenterology consultant and our associate director of nursing within planned care, we were able to agree with the staff on the gastro unit that we would trial it for a 1 week period. So the shifts were added to the roster. These were picked up by the nurses that worked on that unit already. And the 1 week trial was a success. So then we agreed then to do it for a little bit longer, try and cover the Amber Alert for the rest of the month, and then just see where it went from there, really. So I am pleased to say it's still running today. It runs Monday to Friday. We have up to 4 patients per day now. So we offer times, for example, at 9, 11, 1 and 3, and the IV iron infusions run over 30 minutes. So this just allows additional time in the event of like a minor, if there's a minor infusion reaction, or be it a hypersensitivity reaction. The shifts remain on the roster. These are all generally picked up by the ward staff. Within our trust, we have a trust internal agency register, so staff were able to just pick up a couple of extra hours here and there, or sometimes they just had a little bit of time that they needed to make up, so they picked it up. The ward clerk, we have an amazing ward clerk on our gastro unit. She manages all the bookings, she manages all the referrals, she books patients into our virtual chairs on the unit. So for example, our pre-assessment, we'll check the results of our patients coming in for elective procedures. If they're found to require iron, they'll give the gastro unit a call and arrange to get that patient in with the ward clerk. So it is running really, really well. I think offering it as a trial, I think doing it for a week and then expanding it a little bit and then expanding it a little bit more actually allowed us to get the ward staff on board, get them in as stakeholders really, just to try and review if this was actually working. And it has been really successful. Looking at what we've learned across the way, so looking at obstacles really, the main thing around something like this is just making sure that it's staffed, making sure that these staff are obviously competent, able to administer the infusion, but also being competent to deal with any potential reactions that might occur along the way. We'd have had issues sometimes, of course, with last minute sickness. This might result in patients having to have their infusions rescheduled, but sometimes if they only have one patient in that day, the ward staff will try and accommodate the infusion along with the inpatients. We do have other issues as well. Sometimes we'll get patients obviously not attend for appointments, which we're always going to get. We might get, we have had occasions where patients have actually ended up being admitted to hospital at times so that their infusions were booked. But again, these are all unavoidable issues really. And more than anything, what we've had from this is really positive, a really positive impact. We obviously already know it's well evidenced and reported that IV iron reduces the requirement for donor blood, and obviously all the risks associated with patients having to have a transfusion, an extended length of time in hospital, that kind of thing. We are in the process of, we're currently doing a national comparative audit for the NICE quality standards, and one of those questions is, were patients offered IV iron? So that's certainly going to have helped improve our compliance with that kind of process. We already know that IV iron obviously as well is a lot more cost effective, but I think from a personal point of view, from the trust, we found that the service can be quite flexible. We've had really positive feedback from patients. They've sometimes had to change their appointments, and we've been able to accommodate that. So these are all the things that improve patient care and patient experience. I think as well, an unexpected perk is it's improved. The staff have really taken it on quite well. Obviously, we all work in times at the moment, don't we, where staff are often having to be moved because there's shortages in other areas. But this is something that we do take into consideration. So when we're looking at staffing in other areas, one of the questions is asked, do you have any infusions today? Because we have to appreciate that we have to have the right staff on the unit dealing with these patients. So just to let you just look at who's actually using the service really. So by December, even though it was still a relatively new service, we had 26 patients attend for iron infusions. And then by March, by this March, we've had 47. So it is certainly, the word is getting out there that this is a new service. I did a bit of a look back last week, just at looking what kind of specialities were starting to use it, and I've pulled this data together for March. Now, March probably wasn't the best month to look at actually, because we did have 4 industrial strike days. So we had 2 days of nursing strikes, 2 days of doctor strikes. I think actually when you look at that and you consider that it doesn't run on weekends, and we have had the strike days, to jump up to 47 from 26 just a couple of months ago is obviously again really positive. There were 4 days that we were not able to get staff cover, simply because we just couldn't, there was just no staff available on those days, but that didn't cause a problem. It still allowed us to book patients in on alternative days. It's been quite well received by gastro because they've been able to expand their service. They were just doing 1 patient per day, whereas some days they might have 2 or 3 infusions going on. We've also had a really good intake from areas such as gynae, orthopedics, general surgery, and now we're just starting to get some urology and vascular cases booking in as well. So I think looking at this, we're quite confident that surgery is making the most of the service. And we're already, again, as I say, quite confident with haematology and maternity. We just need to just have a look at other areas, just make sure that nobody else is missing out. But overall, we have really seen this as a real positive to our trust. It's a short and sweet presentation, but that's it from me.